Hi, I'm Dr. Vonda Wright, and this is Hot for Your Health. Join us for conversations on the bleeding edge of science, health, and culture as we bring you tech innovators, thought leaders, and the movers and shakers who are transforming science fiction into your new health reality. So let's talk about this new group of symptoms that women feel throughout a lifetime and what you can do about them to continue to feel amazing. So the things that I've just named for you: arthralgia, which is total body pain, loss of lean muscle mass, loss of bone density, perhaps inflammation that causes the very common diagnosis of frozen shoulder, are all part of what I've coined as the musculoskeletal syndrome of menopause. So this gives us a nomenclature that we can use when talking to our doctors, when talking to each other, and it is fashioned after the gynecourinary syndrome of menopause, which the OB/GYN community coined many years ago, actually, and helps just have a discussion. So the musculoskeletal syndrome of menopause, what is it? Who gets it? How can we treat ourselves and educate our physicians to help treat us? Well, and why does it happen? So estrogen, as you know, is made by our ovaries during the period of our lives when we are fertile, when we are capable of having children. As our ovaries retire, which starts in many people around age 35, and then complete their work by around 52, we lose the amazing parts of what estrogen does for the rest of our body. Sometimes we think of estrogen as simply a sex hormone, and it is not. Estrogen is ubiquitous. It has roles on every tissue in our body, including muscle, bone, tendon, cartilage. And so therefore, when estrogen starts to precipitously drop, or then walks out the door and never looks back, of course, our musculoskeletal organs are going to feel the effect of that. So let's first talk about the role of estrogen in inflammation and how that manifests in the musculoskeletal syndrome of menopause. Estrogen works directly on a molecule in our bodies called the inflammasome. Estrogen itself is a huge anti-inflammatory. Without the effect of estrogen inhibiting a molecule called TNF-alpha and modulating the release of inflammatory chemicals in our body, we can feel hot and inflamed all the time. And we typically know that as hot flashes. That's not what I'm talking about. When inflammation rises in our bodies, when it comes to the musculoskeletal system, our tissues become inflamed. In many women, this will manifest as a frozen shoulder, a frozen hip, just feeling achy all over. The achy all over is called arthralgia. It's total body aching. 70% of women have arthralgia. Sometimes women are diagnosed with fibromyalgia, which is a bucket of, we don't know exactly what's going on, but we think you have this, when actually what is going on is women have lost their estrogen, their inflammation increases, and it is arthralgia, total body aching. So that's very common. That was my primary and first symptom of perimenopause. I'm used to being an athlete. I was active all the time. I could barely get out of bed. So arthralgia. A very common manifestation of the inflammation of musculoskeletal syndrome of menopause is frozen shoulder. Now remember, I'm an orthopedic surgeon. Women come into my office all the time with an inability to move their shoulder. They simply can't lift it up anymore. And they also can't lift their hook their bra. I call it the can't hook your bra sign. it feels insidious, like I don't know what I did. I didn't bump my shoulder, but all of a sudden it's an excruciating pain, hot and red, and I can't move it. That is due to estrogen walking out the door and your tissues becoming inflamed. I'll tell you what to do about these things when we're done. So that's inflammation, right? Estrogen works to decrease inflammation. Without estrogen, you become highly inflamed. Number 2, let's talk about your muscles. Estrogen, especially the estrogen alpha receptor, there's multiple estrogen receptors, alpha and beta are most common, have a critical role in maintaining lean muscle mass in your body. Losing muscle mass and strength is one of the hallmarks of aging in general. Without estrogen, we have a rapid decrease in our skeletal muscle, such that we lose about 0.6% per year, in addition to normal aging loss of skeletal muscle, unless we do something about it, which I'll tell you. So what's the big deal about losing muscle mass? I mean, you don't even notice it, right? Well, you do notice it. You notice it because it is one of the key contributors to frailty in women. It is not uncommon, as I take care of women in their 70s and beyond, for them to fall down in their own kitchens. And when they fall down due to weakness, they break their hip, which we'll get to next. Or you can't carry your groceries in anymore by yourself. You can't open your pickle jars. You just can't get through your activities of daily living because you have lost so much lean muscle mass. Estrogen and the lack thereof is critical to that process. And I'm going to tell you what to do about that. So we talked about inflammation. We talked about loss of lean muscle mass. Let's talk about loss of bone. Perhaps the most common and known consequence of losing estrogen is osteoporosis. 200 million women in the world have osteoporosis or weak bones. How do we know if our bones are getting weak? Well, the first thing you can do without even going and having a test is to ask yourself, is your mother shrinking? Or am I shrinking? Did I used to be 5'4" and now I'm 5'2"? That is due to the compression of our bones. That is a known risk factor, is familial history of osteoporosis. Other risk factors of low bone density are being female, are being little, are being Asian, having smoked, having taken a lot of steroids in the past for other illnesses, and, my friends, the loss of estrogen. Here's the deal. Osteoporosis can be prevented. We know it's coming. We can get in front of it and therefore get in front of frailty by exercising, and I'm going to tell you how to do that, but by considering hormone therapy at every age, and we'll talk about this at the end. Because what happens when we become osteoporotic? Well, number one, we become frail. We have a 70% of all hip fractures occur in women. If you fall and break your hip, 50% of the time you will not return to pre-fall function, and up to 30% of the time we will die. So as an orthopedic surgeon, it is critically important that we get in front of our bone density, not just starting when we're already midlife, but we should be concerned about it when we're our daughter's ages. So we talked about inflammation, muscle, we talked about bone density. Let's go a little bit deeper into the muscle conversation. I'm going to tell you that even our stem cells, our muscle stem cells, which are called satellite cells, respond to estrogen. And so without them, we lose the very cells of longevity to reproduce our muscle. So the last category I'm going to talk about is osteoarthritis. We have known for almost 30 years that there's an association between being midlife and losing estrogen and the rapid development of osteoarthritis. And yet it is very rarely spoken about. Here's the deal. When you're less than 50, men have more osteoarthritis. Around 50, women's osteoarthritis rapidly increases. Why is that? Well, once again, Estrogen is critical for maintaining the cartilage matrix that supports our bones. So without estrogen, our cartilage matrix breaks down more quickly and we're more prone to osteoarthritis. This is not new for women. We have known this forever. And it too can be prevented by getting in front of it. So I've talked a lot about the 5 signs of the musculoskeletal syndrome of menopause that are directly influenced by precipitous drops in estrogen in our bodies. So what are we going to do about it? Here you go. Number 1, you must make a decision based on science whether you are going to participate in hormone replacement therapy or menopause hormone therapy. This is an individual decision. You get to make this decision with your physician, preferably a menopause certified physician. But here's the deal. You must make this decision based on science and not fear. Science, not old wives' tales. Science, not what you read in the tabloid papers in the newspaper. The way you get in front of this is, here's a suggestion. This is what I did. I read Estrogen Matters, which is by Avram Blooming and Carol Tavris. It's a book that puts together all the research surrounding estrogen and risks. Decide for yourself. Talk to your physician about it. If you cannot find a physician in your local area that knows enough or is willing to talk to you about it, there are multiple online platforms. The CEOs of 3 of them I know, and I trust these platforms, including MyAlloy, Evernow, and MIDI. Find an online telemedicine doctor, several of which will take your insurance so that you get the best care, but make the decision. That's number 1. I have decided to take hormone replacement therapy to protect my muscle, my bone, my brain, and my heart. It's your decision. That's number 1. Number 2, there is unequivocal data that exercising will help you maintain your lean muscle mass, your bone density, your brain, your cardiovascular system. How do you want to do it? Well, if you listen to me on Instagram, you know that I want you, if you do nothing else, I want you to lift. And I want you to lift as heavy as your bones will bear. We need to put down the mamby-pamby pink weights at doing 20 reps, 4 sets. What are we lifting for? We are lifting for longevity and we are lifting for power. To do that, we lift heavier weights, lower reps. So I tell my people for the primary lifts, upper body push-pull, lower body push-pull, 4 reps, 4 sets. That means the weight has to be pretty heavy. Now, the question I get all the time is, what is heavy? Here's the good news. Your heavy is your heavy. It is the weight you can lift 4 times and be near exhaustion, right? I'll give you an example. When I do biceps curls, I can biceps curl 15 pounds until tomorrow morning. But when I grab a 25 pound, I can only lift it about 4 times before I'm having a lot of trouble and I'm almost at failure. So for me, heavy is 25 pounds when it comes to the biceps curl. Every exercise will have its own heavy, and every woman will have their own heavy. If you have never, ever lifted before, this is an amazing time to start. Or if you used to lift in high school but can't remember how, you can start with simple movement patterns. I've written several books containing this information, including Fitness After 40, Guide to Thrive. They have 6-month body weight exercises just so you learn how to move again. And then you can progress to lifting heavy, which I've taught you to do on my Instagram page, Dr. Vonda Wright. If you have one thing to do and no other time, you lift heavy. So number 1, make your estrogen replacement decision. Number 2, lift heavy. Number 3, we still need cardiovascular health and a cardiovascular engine to prevent frailty as we grow old. We can stop with the high-intensity interval training 7 days a week. That is what we used to do. That's what ended up a lot of people in my office with injuries. The best way to train for longevity is base training, which is lower heart rate, base training, zone 2. I talk about all this all the time on my Instagram page, plus sprint intervals. Now, don't worry, sprinting is not like Usain Bolt sprinting. Sprinting is maximum effort for you. So how I prescribe mobility is 3 hours a week of base training divided into 45-minute episodes. So 45 minutes on a treadmill. Plus, after you've warmed up, twice a week, you're going to sprint 30 seconds and completely recover for 2 or 3 minutes. The combination of lifting heavy and this kind of cardio, zone 2 plus sprinting, this is how you recompose your body. Notice I didn't say lose weight. Notice I said recompose your body. Using this method, I decreased my body fat by 12%. I gained about 8 pounds of muscle in over the course of a year and a half. And I did lose weight, but that wasn't the point. I totally recomposed. That's what we need to do in midlife. So number 1, HRT decision. Number 2, lift heavy. Number 3, base training plus sprinting. Number 4, anti-inflammatory diet. Yes, we need to focus on green leafy vegetables, lean protein, 1 gram of protein per ideal body pound so that we can build muscle protein synthesis. And okay, my friends, I'm going to say it. You're not going to like it. Nobody likes it. But if you are intent on being pro-age, aging well, in longevity, in not being inflamed, we've got to cut out simple sugar. It's cooking us from the inside out. It's giving you wrinkles. It's making you more inflamed. No added sugar, no simple carbs. Focus all your carbs on fiber, 25 to 30 grams a day. So I've given you the 5 diagnoses for the musculoskeletal syndrome of menopause. Know that that's what they are. Talk to your doctor about it. It is inflammation, osteoporosis, loss of lean muscle mass, decreased satellite cell production, and arthritis. And then invest in yourself every day. Here's how I prescribe for my people. Make your HRT decision. Lift heavy, base train plus sprint intervals, and focus on anti-inflammatory nutrition. Now, here's the last thing. This recipe gives you a stronger brain. Listen, I'm an academic, and I want to preserve my brain. Everything I've told you to do helps preserve your brain. We actually have an incredibly hopeful future by taking control of the things that we can control today. Because if we don't, I don't want to end on a negative note, but I'm going to tell you as an orthopedic surgeon, I see the future every day when I take care of women who have fallen down. Imagine me walking to their room as their surgeon. They've fallen down, they've broken their hip because they didn't have estrogen and their bones were soft like butter. Many of them are incontinent because their pelvic floors are no longer strong. They've lost lean muscle mass. Many of them have so much heart disease, we can't clear them from surgery, and a big proportion have dementia because estrogen is so critical for our brains. That is our future of frailty. Unless we do something right now, pro-age women, and get in front of this and do the 5 things I told you to do. Because here's the deal. We know that aging is not an inevitable decline from the vitality of youth down some slippery slope to frailty. No, you control your future by the investments you make every day in your own health. So I am so thrilled to be with you, to be part of this pro-age movement, and to put the control for facing your future back in your hands. I hope that I speak to you soon. Please come and follow me on Instagram at Dr. Vonda Wright. And I am thrilled about your hopeful future. Bye now. I'm Dr. Vonda Wright. See you next week.